I wanted to ask about mental health effects of the current transfer landscape. Joe Banaseal, VCU guard, has obviously been very open about his own mental health journey in that regard. And I wanted to ask what sort of infrastructure is in place to meet the needs of incoming transfers when they're adjusting to a new program in a new city.
Yeah, I think that's an important question. And obviously, Joe is very public about his experiences, but not every student athlete is. But I will say that VCU and more broadly, the NCAA and other institutions, I think have really identified that appropriate mental health resources are essential for our student athletes now and moving forward. And you've seen some of that with the new, NCAA Transformation Committee rules and basically mandates from the NCAA to its member institutions to provide more robust mental health services. And fortunately, VCU was proactive, before it became a mandate from the NCAA to put in more mental health services and resources for our student athletes. The unit within the department has grown to 3 mental health employees that are able to service our student athletes and meet with them on a one-on-one regular basis to talk about really whatever they want to discuss, but obviously to be there to assist and be a resource as they navigate any mental health challenges that they might be dealing with. And then, for specific student athletes, if the internal resources are not what's needed to help the student athletes work through whatever it is that they're working through, we will outsource that and bring in third parties to help as well. And you can ask Joe. We're very committed to providing what is necessary for our student athletes to help. And to your point, transferring 4 times in 4 years, that's going to weigh on anyone. And so as multi-time transfers become more common, we just have to be prepared to be there with those resources for our student athletes.